Hello, my name is Sarah Mackenzie. I am one of the respiratory therapists working with Breathe Easy in Red Deer. Welcome to your Breathe Easy education. Today we're talking about management of respiratory infections. This is a one of three-part series in which we will introduce the breathing action plans we've been talking about a lot. So if you're working with a binder, we are working in section 8 of the binder. So if you are taking these in order, last time we talked about benefits of exercise, obstacles and solutions, how to recognize your limits, customizing a program for you, and how to maintain long-term exercise. From this point on, any questions about exercise at all, direct them to the physiotherapist in the program and they will help you with that. So today we're going to introduce the breathing action plan, including objectives and structure. We'll talk about signs and symptoms of a respiratory infection or flare-up. So when we're talking about the breathing action plan, there's actually three topics that we will use to complete this document for you. The first one is how to tell if you're getting a chest infection. Then we'll talk about identifying and managing your triggers. And we will also talk about our emotions, our stress and anxiety, and the relationship that plays with our breathing as well. So at the end of this three-part series, and certainly by the end of the program, you will have a comprehensive breathing action plan document that you can share with your respirologist, your family doctor, and anybody else that may want to be involved in your care. And it's a great way to show them that, hey, I have complete knowledge and empowerment to manage my lung disease on a day-to-day. So it's a really, really, really helpful document. We will also talk about factors that increase your risk of developing a respiratory infection and strategies to prevent and treat a respiratory infection, okay? So I'll direct your attention. The first page in that section 8 in your binder is an awareness exercise. So we have already taken the time to write down what your everyday lung disease symptoms are. Earlier in the program, we talked about that in detail, getting those written down. So we are building on that information now. It's important to know what's normal for you so that you can quickly identify when something changes, right? So if you flip that page over, the next 3 pages, 2 to 3 pages is what I want to draw your attention to. So there is 2 action plans in here. The first one is either a 2-pager or this could be double-sided. And it says living well with COPD at the top. This is the standard breathing action plan that is most commonly filled out. So there's a 2-pager here. As you can see, there's lots of room to write stuff down. I also wanted to include this 1-pager. This is the one that I most commonly used when developing a breathing action plan with my patients in home care. And I found this quite successful because you can get everything down onto 1 page. So as we're going through the presentation, take a peek at both of these breathing action plans. And the goal is by the end of today, you have an idea about which one you want to fill out. You don't need to fill out both, just pick one that you will work with. Some people like to fill out both, give the 1-pager to their doctors and specialists, keep the 2-pager at home, really whatever works for you, okay? So we'll talk about the components of the action plan, but here they are. So there's your contact list. We'll talk about why it's important to have all of your important numbers down on 1 page. Then you can see the next few categories here mimic the colors in a stoplight. Today, I'm going to introduce to you a different way of thinking about your breathing and communicating your breathing and your breathing needs to the people that are important to you. Okay, and that's using the stoplight system. So the green or green zone, as we like to call it, is I feel well, I feel good. If you think about that in stoplight terms, it's all systems go, like full steam ahead, right? So we'll talk about what that means. The yellow zone is caution, right? Slow down. Something's different. Something's changed. I feel worse. What does this mean and what do we do? We'll talk about that. And then there's 2 more categories. I feel much worse. So what I'm doing, the strategies that I've implemented at home are not working. What do I do? And then we'll talk about I'm in danger. So not just when you're managing a chest infection, but at any point in your life, these are the things that you will watch out for, and this is what to do about it, okay? So benefits of a breathing action plan. Well, hopefully you're more aware of what your everyday breathing symptoms are. Hopefully you had a chance in a previous presentation to list your regular daily activities and your shortness of breath that's typical with those activities. So out of 10, you're bored doing those activities. Things like getting dressed, walking, doing the stairs, cooking, anything that you're doing in your day-to-day, it's really important to know what your typical shortness of breath is. If all of a sudden you're way more short of breath doing an activity than you typically are, that's a change, right? So we need to be aware of these things. List your regular daily medications. So regardless of if you're having a good day breathing wise or a bad breathing day, you're still taking respiratory, this is respiratory specific, you're still taking medications on a regular basis, right? Recognizing increased symptoms and the aggravating, that should say, or factors, or I like to say triggers. So recognizing your increased symptoms and what might be causing those. So sometimes we know, and we'll talk about that, and sometimes we're not exactly sure, and we'll talk about that as well, okay? And we'll talk about techniques to prevent worsening of symptoms. We've already been building up this information over the course of the program. We've talked about energy conservation, breathing techniques, coughing and huffing techniques, pacing, how to climb stairs properly. These are all techniques to manage, reduce, and mitigate your everyday symptoms, okay? And start early to prevent further loss of lung function. We're talking about initiating antibiotics and prednisone to treat that chest infection. Okay, so early detection and treatment means that bacteria and that illness won't spread to the point where you need to go to the hospital. Every time you get a chest infection, your lung function gets knocked down a notch. So you never quite go back to the way you were prior to that infection. So prevention is certainly the most important, but making sure that you have as much reduced symptoms and severity of your symptoms as possible so you can feel yucky and recover at home as opposed to spending weeks in the hospital. That's huge. Okay, so that's just some of the benefits to having the breathing action plan in place. So let's talk about the contact list. If you're looking at the one-page document, it's in orange here. And if you're looking at the 2-pager, it looks exactly like it does in the presentation. So it is the blue section right here. So there is space to write down all your important numbers. It's really important that we have these on this document because if you're sick, if you're having a rough time, you're not really thinking clearly, if your breathing's affected, certainly you're not thinking clearly, rifling through your junk drawer trying to find business cards is not a good use of your time. So this is why we have all of our important contacts down on our breathing action plans. And also, you might not be the one who's going through this list. So this might be your support person, if that's a spouse, a child, a friend, a neighbor. They might be the ones looking at this list. So they need to know who to call when you need help. So for sure, have your respirologist on there. But people tend to have unrealistic expectations of their specialists. Specialists are spread pretty thin. They are not available on a whim. I think I know one or two that possibly can be at times, but generally speaking, you're not calling them in an emergency. This would be more so something's happened and now I'm back to my baseline and I need to be followed up, but don't expect them to answer you right away and don't expect to get in to see them right away unless you're really lucky, okay? So your family doc, definitely have this on your contact list. I would include the clinic that they're at and the number at the clinic. Resource person. So depending on who you are and how your life is, this could be your spouse, this could be your PCN nurse, this could be a neighbor, a friend, whoever is the person that you call if you need assistance. If you live alone, and we'll talk about this later, it's really, really important that you have a contact person and that you let them know when you are sick. Because if things go south and the medications you're taking are not working, they need to be checking on you. And if you need to go to the hospital, it's really important that they check on you. Okay, so we'll talk about that in a bit. So resource person is whoever you might need to contact. Okay. And your pharmacist. So if we're getting antibiotics and prednisone, you'll need to get that dispensed from your pharmacy. So having that number is really handy. And anyone else that you think you might want to have on here for your own organization, or in case somebody else needs to take a look at this document and make calls for you. Okay, so that's contact list. Let's get into the green zone. So it's number 1 on the 1-pager, and it's located right under contacts. Ooh, sorry, there we go. Right under contacts on the 2-pager. So when we're talking about green zone, like I am in the green zone, I am having a green day is how we communicate that. That means that you've had a decent sleep, you're feeling pretty good with your breathing. If you have phlegm as part of your daily lung disease symptoms, you're able to cough that out. You're feeling good energy-wise. Most people with lung disease know if they're going to have a good day within kind of half an hour to an hour of waking up. So this is what I've been told, and I think it holds true. You know right away. So if you're having a green day, the way to communicate that to your friends and family is to say, hey, I'm having a green breathing day. And with a little bit of communication as to what that means, then they know, okay, you're having a good breathing day. We can go to Costco. We can go for that walk. We can have Aunt Susan over for dinner. Whatever was on the schedule that day, you can proceed. And you might be even able to schedule a few more things in. Maybe this is the day that you tackle dusting the blinds, or vacuuming half the house, or doing some meal prep, whatever that means. Okay. So even if you're having a green breathing day, there are still things that you're doing to maintain your breathing. So there's still activities that will make you feel short of breath. So you can write that in there. You may still cough up phlegm or sputum on a daily basis as part of your normal lung disease symptoms. So make sure you get into detail here about what you typically cough out. We'll talk about this here in a bit as to why that is super important. So we're talking amount, time of day, if it has a color, if it's thick, thin, all of those details. And if you don't typically cough, there's a spot to put that as well. Okay. And then your medication. So most of us with lung disease, unless you have, pulmonary fibrosis or interstitial lung disease, most of us are on puffers that we're taking on a regular basis. So your controller puffers would be on here. Your Ventolin rescue would be on here. Any regular pills that are related to your breathing should be on here. Okay. There's also on that 1-pager some extra space to write other therapies down. So are you doing your breathing techniques? Do you have an aerobica? Anything else that you are typically doing on a day-to-day to maintain and manage your breathing? Okay, so that is green zone. So my challenge to you would be to start communicating this with your friends and family. Explain what green zone is and say, if I say I'm having a green day, that means we can go ahead and do the things that we need to do. Okay. What I hear back is that most people, friends and family supporting and loving somebody with a chronic lung disease, are ecstatic to hear this because it's easily conveyed and it's easily understood. So now they know, okay, you're having a green day. Perfect. We can do the things. They're not putting pressure on you. They're not constantly asking you how you're feeling. You can easily communicate that. Okay, so that's my challenge to you. Start communicating this and report back as to how it lands. It'll likely be positive. So that's green zone. Right now, we're going to shift gears a little bit and talk about risk factors and prevention strategies before we get into talking about respiratory infections. So I'll just bring up this slide here. These are all things that you can do that will decrease your risk of a chest infection because you're improving your health overall. So live a healthy lifestyle. So that includes things like quitting smoking, exercising, which we're all doing currently, eating well. We'll talk about nutrition here a little later in the program, and prioritizing sleep. So we spend about a third of our lives asleep. And if we're not doing it right, and if we're not setting ourselves up for that restful sleep, it can impact every area of our life, especially our health. Take your medications. So this is not just respiratory medications. Take all of your prescribed medications exactly as they're prescribed. Avoid those aggravating factors or triggers. So the more you're exposed to things that bother your lungs, the more inflammatory process you'll have and the higher your risk of infection. Does that make sense? So it really, if you're a cat lady and you're super allergic to cats, going over to your sister's house that has 4 cats all the time is going to be overall detrimental to your health. And when we're talking about slowing the progression of your lung disease, avoiding the things that make your lungs worse is a huge part of that. So it's tough because, especially if you're an animal person and you're allergic to animals, but that's just one example, right? So avoiding those things will overall benefit you in the long run. And staying up to date on your vaccinations. So making sure that if you do get sick, the severity of your symptoms will be drastically reduced, meaning you can recover at home with a mild infection as opposed to spending some time in the hospital or maybe even the ICU. It does make that big of a difference. So do your health justice and get up to date on all of your vaccines, not just the flu and pneumonia, the COVID as well, and anything else in the future that may be recommended. Okay. So continued, being in contact with a person that has a respiratory infection. Avoid people who are sick when possible. So I'm sure all of us with a respiratory disease, a chronic respiratory disease, have realized that other people get sniffles, mild colds. We don't get mild colds, we get pneumonias. So you can spend the day with someone who has a mild sniffle, and next thing you know, you're on antibiotics and prednisone, and it's 2 weeks of feeling absolutely yucky before you kind of feel back to yourself again. So the best strategy to reduce and avoid that is to avoid people when you're sick. Grandkids is a tough one, right? We want to be around our grandkids and our family, the people that we love. But if they're sick, that's a huge risk for us, especially when we're talking about slowing the progression of our lung disease. So if you do have to be around people that are sick, avoid a lengthy time of direct contact and wash your hands a lot. So washing your hands has always been and will continue to be the best thing you can do to reduce your risk of infection. Okay, so wash your hands well and often. So maybe that means taking some hand sanitizer in your vehicle, in your purse, in your pocket when you go out. Use it often, especially after touching well-used surfaces and or being in contact with people that may be sick. Okay, and whenever you're around a sink, hot soapy water, wash your hands a lot. Right now it's really dry, so you can tell if you've been washing your hands a lot because your skin will be dry. So use a lotion as well. Okay. Using a humidifier without proper maintenance. So ensure your humidifier is cleaned regularly. When I started teaching Breathe Easy, I saw this line and I thought, oh no, I have a humidifier beside my bed that runs all night. And I changed the filter, but I don't know how clean it is. And so I took a look in there. Oh no, it was so bad. Mold and dust and just all of the nastiness. And so the humidifier is putting that out into the room and you're breathing it in all night. So it's recommended that you clean it at least once a week and change your filters often, especially because it's really dusty where we live. Okay, so don't be a Sarah, be better than me. So let's get back into the breathing action plan. So When we're talking specifically about respiratory infection, there are two changes in symptoms that we are specifically watching for that could indicate that we're getting a chest infection. Can you guess what they are? If you said increased shortness of breath and changes in your mucus, phlegm, sputum, you are correct. So these are the two things that we're watching for. So see how it's really important now that we know how short of breath we typically are with daily activities. Because if we're all of a sudden way more short of breath doing normal daily things, that is not good. That is a sign that you could be getting a chest infection. Okay, so keep an eye on these things. If you can typically make it up your basement stairs without stopping, and at the top you rest for a short while and catch your breath, and all of a sudden now you can't make it up half the flight. Or say you're even just taking your puffers and doing your morning coughing, you're way more short of breath. It takes you way longer to recover. That's a sign that something's changed, right? So changes in mucus and phlegm is the other one. So the colors we're specifically watching for are yellow, green, or sometimes just darker. Primarily, this is what happens, but not always. So we're watching for a change from what's normal. So most people notice that yellow-green. The yellow-green color comes from an enzyme that's produced by bacteria called myeloperoxidase. So that actually happens a few days before you start to feel sick. So if you notice that change right away, you have a window. And that's what we're going to be talking about next, is what is this window that we're allowing a symptom change, such as increased shortness of breath or changes in our mucus or phlegm, before we assume it's a chest infection. Okay, so some people, I've been told, hey, Sarah, I always notice that I just have way more phlegm. So usually I have a morning cough and that's it. And now I'm coughing all day and there's way more volume of phlegm, but I don't typically notice the color change. Okay, that's great awareness, and that's specific to you, right? Everybody's a little bit different with how their chest infections present. And it's important that you notice those similarities and you notice that pattern. Okay. Some people notice that they're just way more tired. Like, man, I just don't feel like getting out of bed. I slept for 14 hours last night and I could just keep sleeping. That always happens when I know I'm getting a chest infection. Other people report, I had a guy yesterday say, I always notice this kind of dull, achy back pain. And I know that I'm getting a chest infection. So that was a new one for me. So everybody's a little bit different. These are the most common things to notice. Okay. So treatment of a flare-up, this is the window I'm talking about. You want to start treatment within 48 hours. I'm going to ask a question. Why is it 48 hours and not 24 hours? Well, that gives you the opportunity to have one crappy day. I'll give you a couple examples. Say you had a big follow-up appointment in the city, you were gone all day, you missed your nap, you had to walk forever to get to the doctor's clinic in the hospital, and when you got home at 8 p.m., you were absolutely bagged, and the next day you have zero energy, you're more short of breath. So here's a good example of a change in your symptoms, but you know why. So you can be more short of breath for the next day while you recover from overdoing it the day before without it being a chest infection. Okay, and I'll give you an example with the mucus. So say you had to go over to your sister's house. She has 4 cats. You're very allergic to cats. And then the next day you notice that you have way more phlegm. So the phlegm is produced because of the allergic reaction that you have in your lungs, right? Inflammation and phlegm production. So you'll be coughing out more phlegm, which is a change, but you know why. So you were exposed to cats, you're allergic to cats, now your lungs are kind of angry for the next day. That should resolve now that you're away from the cats within about 24 hours. So those are just 2 examples of things that could happen that could cause your symptoms to change, but you know why. So what we're talking about here is if you wake up on that second day and you're still noticing increased shortness of breath with daily activities or a change in your mucus or phlegm, and anything else that you typically notice with your chest infections. That's a good indication that it is a chest infection and you need to start treatment. So treatment is antibiotics and prednisone, okay? So, and again, just to reiterate, these are the two things that you're watching for: the changes in your mucus or phlegm, yellow-green, change in volume consistency. Sometimes taste or smell is reported. So whatever you notice that's specific to you, and increased shortness of breath. So can you, if you're pretty sure it's a chest infection, can you take your reliever puffer? Yeah, absolutely. So taking your Ventolin will help keep your lungs open, especially if you have mucus production and inflammation with an infection. Ventolin will help. What I don't want you to do is get in the habit of taking your Ventolin every hour, expecting it to help, and it's not helping, and you haven't clued in to some of the other changes in your symptoms that could indicate a chest infection. So Ventolin is a helpful adjunct, but antibiotics and prednisone is the gold standard treatment for chest infections, okay? So you've passed that 48-hour window. What we're doing is activating what's called a pharmacy action plan. That means antibiotics and prednisone. If you get recurrent infections, meaning 1 to 2 or more per year requiring antibiotics and prednisone, it's really important that you have a pharmacy action plan in place. Typically, this comes from your respirologist, although there have been family doctors that have prescribed this in the past as well. Because I don't know about you, but my family doctor is 3.5 to 4 weeks to get in to see. So if you reach that 48-hour window and now you need antibiotics and prednisone and you do not have a prescription, either you're trying to get into your family doctor hoping for a miracle, or you're having to go to walk-in, waiting multiple hours, being exposed to other people that are sick and risk contracting a different bug as well. So neither of those options is good, and it delays the time in which you can start treatment. So if you do have a pharmacy action plan in place, that's amazing. You have a great treatment team on your side. And if you don't, next time you see your respirologist, ask for a pharmacy action plan. For those of you that maybe have got one chest infection or maybe not even any chest infections in the past, this isn't relevant right now. Depending on how your lung disease progresses and the trajectory of your lung disease, this may become relevant. So it's always worthy of having a conversation with your respirologist and deciding together if a pharmacy action plan is relevant for you now. Okay? So what you're doing is you're recognizing those symptoms, taking action within 48 hours, taking additional medication prescribed by your physician. This is antibiotics and prednisone. While you are taking these medications, so you are in healing mode only. You have a chest infection, you need to rest to allow the antibiotics and the prednisone to work. It is the human condition to immediately overdo it the second you start to feel better, which should be within 24 to 48 hours of starting the medication. And we'll talk about that in a little bit here. No, do not overdo it. Really lay low, communicate this, say, hey, I'm in the yellow zone. We'll talk about this in a bit. I'm in the yellow zone. I just need to lay low. Can we reschedule X, Y, and Z? Okay, so your job is to heal only. During this time, use your breathing techniques. Keeping your lungs nice and open will allow that phlegm to come out as the infection and the bacteria is killed off by the antibiotics. Make sure that you're in a posture that allows for comfortable breathing and coughing. And use energy conserving techniques. If you've ever had a chest infection, you know that there is no wind in your sails during this time. So you will get easily played out. So really just lay low and try to conserve your energy, especially because you're going to have to do a lot of coughing to get that infection out. The only way your lungs empty is by coughing. So conserving your energy so that you can get the phlegm out quickly and efficiently is really important. And notify your support person, especially if you live alone. Your friend, neighbor, child, whoever that is your support person, give them a call and say, I have a chest infection. I've just started antibiotics and prednisone. What's typical is for them to check on you in person at least once a day, and at least once a day with a phone call. And their instruction should be, if I do not answer the phone, if I do not answer the door, if I'm not making sense, if I'm a weird color, if you're concerned at all about me, call 911. Because when you're in the thick of it, when you're sick, we do not have the brain capacity to be able to tell that we're headed down the road. What usually happens is, I feel crappy, I'm just going to sleep it off. Depending on what's going on, that may not be the right thing to do, right? So notify your support person so they can be laying eyes on you to make sure that the medication is working, right? We should start to feel better, okay? So what happens? Oh yeah, so this is yellow zone. So yellow zone is on the one pager, it's down here. And on the two pager, it's actually its own whole page. So if you have lots of things to write down, this might be the one for you. But basically, it reiterates what you're watching for. I want you to write 48 hours and circle it, star it, point arrows at it, clearly written on that page. So you know when you experience a change in your symptoms, you start the clock. You're allowed to have a crappy day. 2 days is a chest infection, antibiotics and prednisone. Early detection, early treatment, right? So there are some other things that you can do in the yellow zone as well. Breakthrough medication. So take your Ventolin, as I mentioned. Recovery positions. Is there a position that works really good for your breathing? Write it on here. Your support person or your spouse can look at this document and say, oh yeah, you really like lying on your left side during this time. Let's get you comfortable, right? Fans. So some people find that fresh air blowing at their face helps with their breathing. That's mostly a mental thing, but sometimes it can relieve that kind of feeling of being closed in with your shortness of breath. Sometimes it can cause you to feel really claustrophobic. It's worth a try. Next time you're having a bad breathing day, try positioning yourself in front of a fan, not like super close, far enough away that it's just a gentle breeze. It's winter right now here, but in the summer and spring, sitting beside a window that's open and allowing that light breeze to come in can also help. So it's worth a try. And anything else that works for you to recover from that feeling of shortness of breath, get it in your yellow zone management, okay? So, and just a reminder, we're just talking about chest infections and the management of those in regards to the breathing action plans, but we will be getting more into depth with some different scenarios of when you can get into the yellow zone in the following presentations, okay? So here's the other part of the yellow zone. So if you have a breathing action or a pharmacy action plan with those medications at home, which some people like to have them dispensed ready to go, there is a place on here to write your prednisone as well as your antibiotic. But just know that that's not a requirement. As long as you know when to start them, that's the most important, okay? So 48 hours until you start your antibiotics and prednisone. 48 hours after that until you assess if you need more assistance and more help, okay? So the idea is once you start your antibiotics and prednisone, you should start to feel better, right? That infection is being treated, it's going to start to clear, the inflammation is going to start to be reduced in the lungs, leading you to start to feel better. If at the 48-hour mark after you start that, things are not improving or things are getting worse, what you need to understand is all of the tools and strategies you've implemented at home are not working for this specific situation. That could be a multitude of reasons. Maybe the antibiotic you're on is not treating the specific bug that you have. Maybe there's something else going on as well, or maybe the infection is just too great to manage at home. So whatever that reason is, at that 48-hour mark, if things aren't looking good, or if you're starting to go downhill, you need to go to the hospital. So here it's a little misleading after 5 p.m. or on the weekend. I think this was built in a time when you could still go to your family doctor and get seen same day. But I would really, really suggest, if you're going downhill, go straight to the hospital. If you go into walk-in, there's nothing really more that they can do that you're not already doing at home. So you need to be monitored. You probably need to be on more oxygen or oxygen at all, and just kind of receive that bump up of care that the hospital can provide. So I wouldn't delay at all. If you're starting to go downhill at the 48-hour mark, go to the hospital. So again, this is where your support person comes in really handy. If you're going downhill, if you're more tired, if you're more short of breath, you may not recognize this in yourself. So your support person might be the one to pull the plug and call 911 for you. Okay. So don't delay, because what we don't want is to get in a situation where we're headed towards respiratory failure, meaning the energy required to breathe is not sustainable. You need to be in a monitored place in order, if things continue to get worse, so that they can keep you alive, right? So that's, I feel much worse. I feel I'm in danger. So especially if you're recovering from a chest infection, but at any point in your life, anywhere, these are the things you're watching for to immediately call 911. So I'm extremely short of breath. This would be different than I'm extremely short of breath because I just did a cardio interval and I'm recovering from my breathing and I know it's going to get better. This is, I'm like 10 out of 10 short of breath at rest. It's not going away despite doing breathing techniques. And what I want you to remember is this is not sustainable. So you do not want to be 10 out of 10 short of breath at rest at home, because you'll tucker out. Okay, so call 911 immediately. This could also mean that there's something else going on. Maybe you have fluid around your lung. Maybe you have a collapsed lung. There are lots of things that could be going on that are all very serious. I'm confused and or drowsy. So this could be brain bleed. This could be stroke. This could be that your carbon dioxide levels in the blood have increased because your breathing is not adequate. There are many, many reasons. This one is tough to detect in yourself. So this is where your support people come in handy: your spouse, your neighbor, your friend, your child. If you're not making sense, if you're tough to rouse, if you're more lethargic than you typically are, they need to call 911 right away. And I have chest pain. So this is different than, there's a what's called a little side stitch that lots of people with chronic lung disease get. It's mostly located in the same spot on your side, kind of a sharp pain that gets worse with breathing. It comes on sporadically and it goes away by itself. It's usually in the same place. So the side stitch, or the pleuritic chest pain, it's sometimes called, that's not what we're talking about here. This is new onset, central radiating, sharp, dull, new chest pain. Okay, so this is a sign that you could be having a heart attack, right? So you need to call 911 immediately. The other one on the one pager is blue-gray lips or nail beds. So if you look at your lip in here, it should be nice and pink. If it's blue-gray, that means that your blood oxygen levels are very, very low. So that is also a dangerous situation to be in. You want to call 911 immediately. On the one pager here, there's a little extra information in the red zone about what you can do after you call 911, which is really helpful. For most of us, if we had to call the ambulance, the time in which we finish that phone call and paramedics show up, we are in a full-on panic attack, freak out, respiratory failure state, which is only going to make things worse. And 10 out of 10 anxiety is not sustainable. 10 out of 10 short of breath is not sustainable. You're going to increase the air trapping in your lungs. You're going to be in a very difficult state for the paramedics to try and reverse. So you're already in an emergency situation, but keeping these couple things in mind can help you to remain somewhat in control, even though things are looking bad, okay? So take on a resting position. Your support person or whoever calls 911 might be, okay, we need to get you leaning on a table, okay, and just focus on your breathing. Try to purslet breathe, okay? So they're talking you through that. The other thing you can do is if you're on oxygen at home, your stationary concentrator, your big home unit, crank that puppy as high as it goes. When the paramedics come, they're going to put you on high flow oxygen anyways. You can get a head start on that. So crank it as high as it goes. Make sure you're not on your portable, you're on your stationary continuous oxygen flow, okay? And the other thing you can do is take your reliever puffer, your Ventolin, back to back to back to back to back to back continuously until the paramedics come. So this is not, I'm short of breath after running up the stairs management, I need to take 18 puffs of Ventolin. This is, I am in danger. My health is not good. I need emergency management. So that's what we're talking about here. Waiting until the paramedics come. Your support person, or you, if you're able, is shaking that puffer. You're taking 4 to 5 breaths in and out of the spacer because it's unlikely you're going to be able to hold your breath at this time. And then they're continuously giving that to you. Okay, so when you get into the ambulance, they will put you on a high flow oxygen mask with liquid oxygen through a nebulizer. So it will be misting. They will continuously refill that as you're going to the hospital. So you can get a head start on that bronchodilation. Okay, so keep those in mind, a couple things that you can do while you're waiting for the paramedics to show up. Okay. So that's it for the respiratory infection part of the breathing action plans. So I hope that over the course of this presentation, you have selected the breathing action plan that you like the best to fill out. And what I want you to do is work on filling out your green zone and filling out your yellow zone. So 48 hours, make sure that's down on here. Anything else that works when you're overcoming shortness of breath, get it in your yellow zone. All of your day-to-day management goes in the green zone. The other thing I want you to do is start to communicate this with your loved ones. Practice saying, I'm having a green breathing day. Explain that to them beforehand, what exactly that means, and pay attention to how that improves their ability to support you. Okay. So how confident are you to properly use your action plan? Well, if this was the first time that you've heard all of this, you might not be super confident. But the good news is we have 2 more presentations and we'll work on filling this out. You'll have lots of opportunity to get questions answered so that at the end of the program, you have a comprehensive document with all of your management strategies on there. So recognize changes in your sputum or phlegm if you have any. Recognize changes in your shortness of breath and prevent and manage your symptoms. So give yourself a number out of 10. If it's less than 5, that just means we need to have some more conversations and do some more work, and that is okay. That's the point, right? So to summarize, using your action plan will help you manage your disease when symptoms increase. Use the techniques to avoid respiratory infections. This can help you prevent you from getting sick in the first place and reduce the severity of your symptoms. Knowing the signs and symptoms of a respiratory infection can help you start medical treatment early and prevent progression of your lung disease. So if you've ever had a chest infection in the past, it is very likely that you let it go on too long before seeking help. And by the time you get to your doctor's office or the walk-in clinic, they ask you how long you've been feeling this way. You have no idea. Like, I don't know, maybe a week? I don't know. I was just trying to get a good sleep so I could feel better the next day, and I just kept feeling worse. So now you have the tools, you know what to watch for, you know when to act, so that you can start treatment before you really start to go downhill. And the majority of the time that you do that, you might feel a little bit yucky and you might be coughing out some yucky stuff, but for the most part, you won't be required to go into the hospital, and that's really the goal. So early detection, early treatment, prevent progression of your lung disease, and preserve the lung function you have left. So I discussed homework already. Let me know if you have any questions whatsoever, and we will carry on this conversation next time I speak with you. So that is it for today. Thanks for listening.